Hi guys, so one of the constant themes that's part of Boris Johnson's government's time in power has been to promise something that his administration cannot be in any way sure they can deliver on. Now, we've seen it with Brexit and we've seen it during the pandemic. Boris Johnson promises no lockdowns and then goes into a lockdown. He promises that care homes will be protected and instead care homes are thrown under a bus. So following the Matt Hancock disaster, in steps Sajid Javid, the new Health Secretary, who in one of his very first interviews promises something he probably can't guarantee.
I want to see the restrictions lifted and life going back to normal as quickly as possible. And that's at my right here and now. That is my absolute priority. I want to see those restrictions lifted as soon as we can, as quickly as possible. In terms of the roadmap to that, you'll have to wait for my statement to Parliament later today.
Irreversible is...
Yeah, it's going to be irreversible. There's no going back.
Okay, so I don't know if you heard the question was, will it be irreversible? And his response, of course, is, it's going to be irreversible, there's no going back. So in regards to the roadmap. But the problem with this is that cases are rising. There were something like 16,000 new cases on Saturday. The highest number since February, I think it was. So cases are going up. Obviously, that results in higher numbers of hospitalizations and then unfortunately more deaths. So the roadmap may need to be changed. Him saying it's irreversible is promising something he can't be sure he can deliver on. And he's just now the health secretary. So he shouldn't really be making these types of promises. But once again, these are political promises. They're not actually looking at the data, or I'm sure he's actually seen the data, but he's instead saying, okay, instead of actually following what the data says, let's try and keep the public happy.
And that's why we want to be careful during that process, and I'll have more to say about this during my statement.
Now, you just met hospital staff, as you said, they've had a hard year, you want to do everything you can for them. Does that include arguing for a pay rise? Is that what they deserve?
Well, you know, we have an independent pay review body. I haven't seen what they're going to be recommending yet, but I look forward to receiving that. And what I will be doing and what the government will be doing is providing all the support that we can to NHS staff, the doctors, the nurses, and that will be my general approach, of course.
So when it comes to pay rise, look, there are two possibilities. The government will just give the 1.5% pay rise and put up two fingers to the NHS staff. Or what they may be actually doing is even worse than that. They will give them a 2% or slightly more than 2% pay increase and then do a victory lap, claiming, look, we listened to the doctors and nurses and we're giving them more than we suggested. And this would be used as a political tool to hit the Labour Party. Now, I think the Labour Party should actually use the Royal College of Nurses figures and go with a 12.5% pay increase. Use that as a weapon against the Conservative Party. Say, we are the party of the NHS. We're going to fight for doctors and nurses who've put their lives on the line over the last year. They deserve at least that. Unfortunately, Labour don't seem to be doing that. And I'm afraid that the doctors and nurses, like care homes and like others, will be thrown under a bus by the new health secretary. Well, let's hear what he has to say later on Monday. And of course, I'll comment on that. Let me know in the comment section, guys, what you think. As always, your comments are greatly appreciated. Thanks a lot. I want to say a big thank you to all of my patrons. You ensure that this channel continues to exist. I'm eternally grateful for all of your support. If you join Patreon, you will receive instant access to our Discord server, where we have both audio and video chats. You can chat with me and other patrons, where we discuss important and non-important issues. Becoming a patron per month costs about the same as a large coffee, so why not check it out?